No piece of legislation is going to be perfect, and the Affordable Care Act is no exception. It was not a perfect piece of legislation. Some things were left out. Some things were done poorly. Some things weren't done aggressively enough. And there were lots of unintended consequences. There is no final healthcare piece of legislation. We are constantly going to have to improve, tweak, adjust healthcare. In Massachusetts, after they passed Romneycare in 2006, they in fact have had 6 subsequent revisions of their healthcare bill to take care of problems that they've identified. As a matter of fact, most of the American population understands this. Only 34% of Americans actually want the Affordable Care Act repealed. Nearly 60% of them understand that it should be improved, and that's what they want. What should we do? Well, Healthcare Reform 2.0, I have 6 suggestions. We should raise the cigarette tax to increase prevention, crack down on fraud and abuse, streamline all that unnecessary paperwork, expand competitive bidding, implement payment reform in Medicare and beyond, and make sure that the exchange is working like a modern e-commerce site. So let's start at the top, raising the cigarette tax. Cigarette taxes, we know, actually decrease smoking. We've had a huge decrease in smoking since the early 1960s. Right now, just under 20% of the American population smokes. We know if we increase the cigarette tax by 50 cents a pack, about 3% of Americans who smoke will quit. That'll be good because it will reduce health problems from smoking, like emphysema. It'll also reduce premature deaths. Young people, those between 18 and 24, are particularly susceptible to the price, and they are more likely to quit smoking early. Not only does raising the cigarette tax improve health, it also collects money that can be used to pay down the deficit or invest in other important priorities. Second, we need to crack down on fraud and abuse. It turns out that the return on investment for investing in fraud and abuse is about the best bargain you can get. For every dollar spent enforcing fraud and abuse, the government saves $17. The Affordable Care Act actually added $350 million to enforcing fraud and abuse over 10 years. It strengthened the screening procedures for Medicare providers, but we can do much, much more. I think we should allocate a lot more money to fraud and abuse, and we should require Medicare to change mostly how it enforces the fraud and abuse provisions. Right now, it tends to pay and then chase suspicious payments. We should switch to a prospective system where the government actually encourages private organizations to develop predictive modeling on which bills are likely to be fraudulent, and instead of paying them, actually investigate. This prospective predictive modeling is a much better way to reduce fraud and abuse without chasing. A third area that we need to focus on is reducing unnecessary paperwork in the process. It drives all of us crazy. As you can see from this graphic, private insurers and others pay about $7.50 to process a health insurance claim. Visa processes a charge for 2 cents. What's the difference? A lot of paperwork. Each individual insurance company has its own paperwork, has the specific things they want. Now, mostly they ask for the same information, but a lot of it is unique. And that difference adds up to a lot of paperwork, where individuals in the doctor's office have to fill things out by hand, creating mistakes, creating a lot more costs. The Affordable Care Act did do some things called administrative simplification, requiring the government to establish standard operating procedures and rules that are used to process claims and transfer funds electronically. This is definitely going to reduce the paperwork, but there were some problems. The standards were only apply to payers and require them to adopt them. Doctors and hospitals aren't required to adopt them. That makes no sense. And there were many other things which could be done electronically that were left out of the Affordable Care Act. For example, pre-authorizations for a particular expensive test like an MRI. That doesn't have to be done electronically. Additional information to certify why a particular service is necessary. That isn't done electronically. So one of the things we need to do is to make sure that many more of the billing and processing of claims can be done electronically, require not just insurers adopt the standard operating procedures, but that hospitals and doctors also have to do it. In addition, quality reporting to Medicare and Medicaid should be done electronically. And we should revise the electronic health records incentives to ensure that they integrate with the billing and with the quality metrics. And the best way to ensure all these reforms happen is to empower the Chief Information Officer at the Department of Health and Human Services to issue an annual report and to oversee this process of administrative simplification, so he or she is responsible for it. As we've seen, reforming the healthcare system is a never-ending process. We've just reviewed 3 reforms that can really help the system: increasing the cigarette tax, combating fraud and abuse, and simplifying the administrative paperwork in the healthcare system. Next, we're going to look at reducing prices through competitive bidding and changing how we pay hospital and doctors so that they focus on keeping people healthy.